infected, I infected one person infects one. When you have a really situation out of control is person infects two people or more, because then the increase is just exponential, and that's fire through dry grass. This is what they were all trying to project, and this is what we have to control as we start to reopen the economy. We say we turn the valve on the economy, we open a little bit, and we watch the meter, right? What's the meter? The meter is the hospitalization rate, or even better, the virus spread rate. So you start to turn that valve, you start to bring people out of their homes, you start to reopen businesses, you see that number going up, turn the valve back right away. And this is what we're trying to deal with going forward. And again, nobody has been here before, so we're trying to figure it out. If the virus spread increases to the place where one person infects two people, that is an outbreak. If one person is only infecting one other person, that is basically a stable increase. Ideally, one person is infecting less than one person, and that is a decline of the spread of the virus, and that's what we're shooting for. Just to belabor this one more point, where you've seen an outbreak epidemic spread, it's when one person is infecting more than one other person. That's when you're out of control. On the Diamond Princess cruise, the infection rate was one person infects two additional people. Wuhan was one person was infecting two people or three people. The 1918 pandemic, one person was infecting 1.5 to 2.8. On our severe projection, one person was infecting 1.4 to 1.8. On the moderate projection, one person was infecting 1.2 to 1.4. Okay? What we've done, because of our mitigation effort, social distancing, stay home, lock the door, we brought it to less than 1. Our infection spread rate is 0.9. Okay? Wuhan, which really closed down everything, and locked it up, Wuhan brought the infection rate down to 0.3. Okay? So that's the range we're talking about. But when you think about that, we're now 0.9. We only have a margin of error of 0.9 to 1.2. 1.2 takes you back to the high projection rate. We're at 0.9. That does not leave you a lot of wiggle room. So you're going to start to phase the reopening. You're at 0.9 now. After this entire close down, if you go to 1.2, you're going to have a problem again. So you see how narrow the window is. But New York pause has worked. The close down has worked. That's how we controlled the beast. That's how we got it down to 0.9. However, we're not there yet. We're just at 0.9. Again, Wuhan got down to 0.3. So we have to continue doing what we're doing. I'd like to see that infection rate get down even more. The New York pause policies, the close down policies, will be extended in coordination with other states to May 15th. I don't want to project beyond that period. That's about 1 month. 1 month is a long time. People need certainty and clarity so they can plan. I need a coordinated action plan with the other states. So 1 month, we'll continue the close down policies. What happens after then? I don't know. We will see depending on what the data shows. What does that mean? Tell me what our infection rate spread is. Is it 0.9? Is it 1? Is it 0.7? Tell me what the hospitalization rate is. And then the experts will tell us the best course of conduct based on that data. No political decisions, no emotional decisions, data and science. We're talking about human lives here. As relatively simple and possibly annoying as it seems, wearing a mask is one of the best things that we can do.
Yep,
And
it is.
I understand I'm getting a lot of not happy phone calls off what I said yesterday about wearing a mask in public,
Mm.
but I'm sorry it makes people unhappy. I do not consider it a major burden, and it really is a simple measure that can save lives. And yes, people say it's a personal intrusion on them, but again, remember, it's not just about you, right? I have rights also, and my kids have rights, and your kids have rights, and you have a right for another person to take reasonable safeguards not to get infected. So the masks work. We said in public today, I'm going to include public transportation systems, private transportation carriers for hire vehicles, any operator of a public system, an operator of a private carrier, and for hire vehicles must wear a mask at all times. What does this mean? If you get on a bus, you need to wear a mask. If you get in a train, you need to wear a mask. If you get into a private car service, Uber or Lyft, the operator needs to wear a mask. If you get on a private bus, the operator needs to wear a mask, and you need to wear a mask on a private carrier. So, is this inconvenient? Yes, but you're in a closed environment by definition. You're not socially distancing by definition. You're the front seat of a car to a back seat of a car. You're one seat in a bus to another seat in a bus. This is a precaution for everyone that I think balances individual liberties with a social conscience. This we're going to affect Friday, 8 p.m. Ultimately, what determines the rate of infection? You do, and I do. That's what this all comes down to, as simple as it sounds. It's not about government, it's not about anything else. It's about what people decide to do, and what people have decided to do. They have brought this infection rate down. It's that simple. Nurses, doctors did a phenomenal job. First responders did a phenomenal job. Essential workers did a phenomenal job. But that rate came down because people changed their behavior. That's what happened. It is about the behavior of our people. It's that simple. It's our behavior. It's our level of discipline. It's how we educate our children. It's how considerate we are of others. What we're willing to do to safeguard others' health in our community. That's what makes all the difference on what we're doing. And it is the simple things. It's wearing a mask. It's washing your hands. It's the hand sanitizer. It's the social distance. It's making sure your children understand what to do, what not to do. It's all of these simple procedures that seem almost insignificant, but on a collective basis make all the difference in the world. And it is making smart choices. I want to get out of the house. I'm going crazy. I need to do this. I need to do this. I know, but be smart. Be smart. And gauge what you're doing relative to everyone else and relative to the overall goal. But I will tell you, and I don't know that people truly appreciated this. I don't know that I did. Of all the unique aspects that we have learned going through this, the most positive and the most surprising to me has been how people have responded. The policies that I have communicated are not worth the paper they are printed on. I could stand up here as governor and say, we must do this, we must do this, we